Okay, so let's do a little wrap up on our cold before we move on into our heat and our thermal therapy. Just to be aware, again, one thing that we're concerned about whenever you're applying cold to someone is that you could potentially create a cold-related injury. Now, again, if we do things properly and safely and look at our contraindications and really stay close to our time frames and things like that, that shouldn't be an issue. But there are two factors associated with cryotherapy that increase the risk of cold related injury. So one is decreased skin temperature and the amount of pressure we use to secure the pack. So if we get to those extreme temperatures, which are not normally reached during our typical treatments, that could result in frostbite. Again, that's more likely with our gel packs or our artificial ices, and less likely if we use good old-fashioned ice. But again, if we do too much unrelenting pressure with those ice packs, it's a little more risky. So we just want to make sure we're safe with that. Also with the cold and pressure, we can get an associated traumatization of the superficial nerves. We call that cold-induced neuropathy. So again, specifically with the perineal nerves and the ulnar nerves, which are superficial, really superficial, close to the skin on the median side of the elbow and on the lateral side of the knee. Putting too much compression with the cold can actually damage the nerves temporarily. Sensation usually comes back, but they will tell you that the area is tingling or numb completely, or potentially lose some function. You can get a little foot drop from the perineal one being decreased. So again, just to review those contraindications of all those things that we're concerned about, right? Why we'd want to be really cautious with modalities. Anything with the sensory system, so the nervous system, anything with the circulatory system, that would be affecting those. A lot of our autoimmune disorders we'd really want to look at, myocardial ischemia, things like that. And then our precautions: watch over the carotid sinus, watch over the areas of infection, watch near the eyes, and avoid treating those large areas, especially if someone has cardiac issues, respiratory issues, or hypertension. So just kind of a quick overview of the evidence of cryotherapy that we've been talking about. Studies indicate that ice compression elevation hastens return to athletic participation, but patient outcomes are probably strongly influenced by other treatments as well. So the compression and the elevation, not just the ice. So it's a whole process, right? Patient-oriented outcomes. We're looking at the whole patient, not just one modality. 20 minutes tends to be the default treatment for ice packs, sometimes 15 minutes for immersion, 10 minutes for ice massage, but it's not one size fit all. And actually a lot of the research where we get all these like mixed results is because the researchers are trying to set a standard time limit, and that doesn't work when you have difference in the individual, difference in the adipose tissue levels, and things like that. So a lot of research actually has too little of a treatment plan or a treatment time for us to really see the results that we would expect.